A very good morning to you guys. Welcome to Asake Online. My name is Brighton Ncube. This week on the show, on the CIVIC Forum, we look at different issues that are affecting young people, in particular in Bulawayo, in particular the issue of alcohol and drug abuse. We've got a session from Zimbabwe Liberties Civic Drug Network to learn more in terms of how to report around the issues of drug abuse and substance abuse in Bulawayo across the Zimbabwe. They've been doing different tours around the issues of media sensitization and making the media people know more how to report using which words and which language to make people aware of the alcohol and drug substance abuse. So Zimbabwe Civic Liberties of Civic Union and network came to Bulawayo to help address journalists understand more in terms of terms and references, what can be done in terms of getting to know more about alcohol and drug abuse. We spoke to Knowledge Mupembe coming from the organization there, speaking to us how this program has been faring out and how the reception has been across the country there. Hope you guys enjoy the show. And also later on, we speak to alcohol and drug abusers that are also now surviving abusers there that have been using drugs and alcohol there. They're surviving, they're called the besties under the network there. They've been surviving and they're giving us their testimonies. They hope you guys enjoy the show and give us your feedback and your comments there via the comment section.
In other countries, in other regions, and everywhere. But we also have people or concerned citizens or concerned people who want their relatives, their friends, their families to recover from drug use, right? Yeah, so in every intervention that we are trying to do, there are principles, there are values which can help us to also help our colleagues and our relatives to recover from drug use. So these principles or values includes, or like practices, includes the issue of stigma and discrimination, and also issues of language that we use towards people who might be addicted to drug use, might be depending on drugs. So in trying to implement harm reduction interventions or harm reduction services, like the package that I was beaming before the tea break, to say we need so and so services or interventions for our people to recover from opioid dependency, and also to prevent and manage drug overdose, and also to prevent the spread of HIV amongst those who inject drugs, especially through sharing of needles and syringes, and also those who practice what we call Bluetooth or hotspot. So this headline, do you think can help someone who is in a recovery journey? For example, this one is English. Perhaps English might try to say it, but can we translate it into our local languages? Anyone to translate it? Issues of disorders and trying to help people to recover from drug use. There are values and principles and recommendations from other practitioners, not only in Zimbabwe, but I've mentioned World Health Organization, I've mentioned UNAIDS, and also other players who are into mental health and drug use disorders. We are trying to have psychosocial support practitioners, and also those who provide counseling services to people who are struggling with addiction. So from research, I also mentioned issues of research when we are conducting the work of this nature, the social work in our communities. There is need to understand what is happening in the communities, and also there is need to provide evidence-based solutions to what is happening. And one of the challenges that have been mentioned amongst people who are in the recovery journey was that there is a lot of stigma and discrimination that is associated with that, with service providers, and also those people who do researches, and those people who report some of these activities happening in our community. So this is the evidence that people who report can also exacerbate what? Stigma and discrimination. So when I mentioned the issue of the process of treatment, rehabilitation, and also harm reduction, I mentioned that we do not expect that if a person goes through this process, that person should then relapse to what? To drug use, right? So one of the reasons why people relapse to drug use is the lack of support and a continued stigma and discrimination, which is coming from what? From the society. And this one is through the media. So the session that I want to share with you is on language. So we need to understand that your words matters, and it can encourage someone or can inspire someone to change his or her behavior, and also can contribute to a negative behavior change. To say someone is now feeling also addiction. So this is just a background to say information and tips for partners and service providers. You are service providers. You provide information to what? To the people and to the society. You need to keep in mind that while a person is using, we need to keep in mind that while using person-first language, as well as terms to avoid and reduce stigma and negative bias when discussing drug use and substance use, as well as what? Addiction. So the position on the use of language and to provide a clear advice on what is acceptable to us as communities of people who use drugs by identifying stigmatizing language, and also give non-judgmental, strength-based and respectful alternatives. So the alternative part is very important. So advocates and also even media practitioners can show leadership on how language can destigmatize the disease of addiction amongst people who use drugs in their diversity. So when we are trying to disseminate information, for example, on the sixth pillar of the Zimbabwe multi-sectoral drug and substance abuse plan, which is the media and communications. That's where you as media practitioners plays a role in trying to destigmatize addiction and also destigmatize drug use disorders, so that you help people to recover from addiction and drug dependence, and also make sure that people are supported not only by the provision of treatment service or medications, but the information or the language that they are taught is also trying to support them in their recovery journey. So language is fundamental to all human societies. When we are saying language is how we make and shape the meaning. So if we are to go back to HIV programming, you remember how people living with HIV have been stigmatized, right? And how that stigma affected them to go or to continue taking their medication when they were initiated on ACT, and also even their families, to say someone might be depressed because of that, and they decide not to continue taking their medication because they know they will be stigmatized. And people also got to a point that they know the days where people go to a clinic or a health facility to get the ART refill. So even the nurses or the healthcare providers, you call those of green books, go to this one, to this room, and at that facility there are people who are not HIV positive, who then will know. So someone is going to the room or room C4 to access what? To access ART. And from there it will be gossip after what? After gossip, trying to stigmatize that person who is what? HIV positive. So on this one also applies to addiction and drug use and drug use disorders. When we are saying language is how we make or shape the meaning of addiction or the meaning of this chronic disease of disorders or drug addiction. Place or a nation, the stigma about people who use drugs and people with substance use disorders might include inaccurate or unfounded thoughts like they are dangerous, incapable of managing treatment, and also at fault of their condition. Because you say how can I help you if you choose by yourself, you deliberately choose to take what? To take drugs. So you are not concerned about your what? Your future, about your life. So this one is where stigma starting to say you are blaming people that it's your fault to be in the condition that you are. So if we are willing to help people to recover from drug use and also from addiction, that's where we then understand, and the issues of empathy then applies to say you put yourself in the shoes of what? The person who is addicted. And when you put yourself in the shoes of the person who is addicted or struggling with substance use disorders, then you understand the reasons why that person got into drugs and why that person requires support and help. So where does stigma come from? For people who use drugs and people with substance use disorders, stigma may stem from, hey, I am not so good with English, but antiquated and inaccurate beliefs that drug use or addiction is a moral failing, instead of what we know that drug use is a chronic disease or a chronic disease which can be treated and from which patients can recover and continue to lead healthy lives. So, in other words, what we are saying here is addiction is not a moral failure, but this one is a chronic disease which can be treated. And if someone is treated from addiction, that person can also continue leading a healthy life. So there is need for support, and support comes from us, it comes from everyone. And for that, it means we need to end stigma and discrimination, especially on the language that we use towards people who use drugs. So how does stigma affect people who use drugs and people with substance use disorders? So feeling stigmatized can reduce the willingness of individuals with people who use drugs to seek treatment. So one of the questions that I asked, how many of us here are willing to help people with addiction or substance use disorders to get help? So if people are stigmatized, for example, at a health facility, it means tomorrow if you are supposed to go for another checkup, you avoid to go there, right? Because the nurses or the healthcare providers are stigmatizing and discriminating you. So this one will then reduce the willingness of those people to seek help and to seek treatment. So due to criminalization, people who use and inject drugs experience high degrees of stigma and discrimination from family, friends, and the broader society. And stigma breaks down trust, prevents communication, and leads to shame and marginalization. So this is one of the adverse impact of stigma. So if there is no longer trust between us, at the end of the day, the family members or the friends might make sure that the person who uses drugs or someone with substance use disorders can be arrested, because drug use is criminalized in Zimbabwe, right? But if we are coming from a public health approach and someone now has mental disorders which are induced by drugs, and also someone with substance use disorders, then it means to support that person, we need trust, and we need communication, and also avoid marginalization, so that that person can be linked with the treatment, can be linked with their potential options, and all other interventions that they need. From this table, you can see, instead of using this, let's use this because of what? Of this. But the main reason is to say the recovery journey and the recovery process requires support and requires people to be empathetic. So instead of using addict, the recommended term is like a person first, where we are saying a person with substance use disorder, and a person, because we are using the person first, because we are a person before drug use. Then instead of user, but user is it's neutral, quite neutral, but the most recommended terms person with opioid use disorders or substance use disorder, and or a person with opioid addiction when that person uses what? Opioids. So the reason is that the change shows that a person has a problem rather than is a problem, right? Yes. So a person has a problem of what? Of drug addiction. But I'm not a what? A problem. Then we all have all these names like a substance abuser or drug user, and we agree that addiction is a chronic disease which can be treated, right? So if it is a disease, someone with a disorder or a disease, that person is a patient. And we are now advocating to say there should be services and treatment services for these patients to access. And some people call people who use drugs like junkies, alcoholics, drunk, former addicts, reformed addicts, and the picture that I've been beaming, right? Yes, so these are some of the recommended terms to use. So people in active use, the person is in active use of what? Of drugs, and a person with alcohol use disorder, a person who misuses or engages in unhealthy and hazardous alcohol use, a person with recovery or long-term recovery, a person who is previously used drugs. So the term avoid eliciting a negative associations or punitive attitudes. And if we are to talk about them and describing someone, it is stigmatizing and dehumanizing that person. But if we are now to support that person, that's where we use the person first language. I think this one I presented it.
New good relationship with my family. I've got a son, he's 14 years old now. My husband passed away in 2010. So we take a for 2010. Kahle babonke yonke impilo kimi akusela lutho. So abantu yonke mabe semfeni bayakutshela ukuthi no, we are going to help you. Ngalook for the kid, but akule ngakubonayo kusenzakala. Ngazivalela almost for 2 to 3 weeks. Ngizivalele endlini. Ngaphuma phandle, I started to drink first. Nganatha, ekunatheni ngahlangana nabantu ababhemayo. Ngoba abantu ababhema imbanje. Ngaqonda khona ngale ngathi hayi ngicela ukutest. I tested imbanje. Ngazizwa ziyangambela. So ngihlala sengiyembanje every time. Then uyakuhlangana abantu abatshiyeneyo endaweni. Ngabe sohlangana ne-meeting babhema imbanje, but I didn't know ukuthi imbanje leyo bafake ama-pills inside. Ngabhema. Ngazibona ukuthi I still need that thing. Ngithethe nga manje uthi no sile base esilayo. Ngihamba kubhesi yabo. Kubhesi yabo guys. Ngase ngizibona sendefile. Smoking with them, drinking with them. Ngabe semfundela lokubhoma insosot. Insosot is a dangerous drug. Some. Ngase ngiqeda ama-globe endlini. Impahla ngikulu. Because I wanted that thing. Ukuthi I've got a crave. Ukuthi ngabe ngabhoma more and more and more. Community wabantu abasebesithi impilo yakhe lovele ayisekho and I was rough futhi. Lokuchaya nganjaya vele ngangaphuzi. Ukuvusana labantu ukwenzani. Habe kufika omunye umama uthi kanti what are you doing? Can't we hlale phansi sikhuluma sithi siyakhuluma lana kodwa into engiyakhuluma lana. Mina yami impilo umuntu engakhuluma la usemangcwabeni. Ngothi lini? Ngimxotshe ephuma ehambe. Ephenduke veki. Ngimxotshe ephuma ehambe. Ngazibona ukuthi umnawo wami abebuya all the way from South Africa. Sebemtshelile ukuthi usisi wakho ngapha. usenguwunye lo mzimba lo sengibona ngiphika ngase ngicakile uzilani into awudli awulali usosothi awulali impahla wesithi bengangithumela kantatha ngitheni futhi ngithole ukubhema kuphela ukuthenga ukudla ngathathi bacela bengithathela umntwana wayohlala losisi wami babe kungidla kakhulu ukusebenza bengithathela umntwana so babona ningehluleka avele sengisehluleka ngabhema kakhulu guys babe sekufika amankazana ethu banihlalisa phansi ngathi lingantshela lani lina ivele liyisidakwa lani anisake sihlangane emabhawu but I know there's a program enje ngathi alike channel ngahlala continuing ngikwenza khona abazaye badini ukuphenduka backini bathi ano kule workshop ekhona eMcDonald lapha cela ukuthi uchaye iround ngahamba ngone yini Zimbabwe Liberties and Drug Network ngathi selisibizela abama-drugs manje la selifuna ukusikophisa yikho lisibizela khona la ngaphuma ngaya kumaphandle bathi hayi akubophisi, there's no police involved inside, is what they want just ukuthi benjani besincedise. But anzange ngamthatha serious, ngamthatha kancane. Then ayingezwa owakhulunywa phakathi. I'm recovering at just, but still I've got those cravings. Siphuma mbijana. Zimbabwe CIVIC Liberties and Drug Network. Yibo abanye abancedisa kakhulu ukuthi into le nje iphume yini. So bagcina sebengikhethe to be the best of the community. Ngilabo abafana abantwana abancane ama-youth bajwayele kakhulu. I go kibo, we share stories, nami ngingene ngelokhuzeni yethu Zimbabwe CIVIC Liberties and Drug Network. Guys, it's like this and this, but it's tough ukuthi beze bekuvume khona. But I'm happy ukuthi babuya mbijana. So now we are forming ama support groups, and they are listening. Uyabazi ukuthi mawubalanda bayothi kule mali kulanda ukuthi I know akuna mali, imali izaba khona phambili, but now bafuna ukuthi besincedise ngani ama projects. Silaba abana bethu abafana bethu abasela mpahla abasela same like me into engangiyenza, same like me amuchiya na. So I mbonga iZimbabwe CIVIC Liberties and Drug Network ukuthi ingenele lo mlimo wangenela futhi ukuthi kube kuphuma mbijana. So ngiyafika ngihlalela abanye ngibabone bebhema, but ansela crave lana ukuthi bethi naku ithi I know alikeli mbijana. So it's a tough thing, guys, but yaphuma mbijana yaphuma. So that's my story, guys. How I started to smoke. So ikufana naphandle lapha abafana bethu nomsebenzi batshona behleli, so into ezenza ukuthi begcina benjani sebengena ezintweni ezishiyeneyo zamazwe ama-drug users, sibesiba babinye besithi izidakwa yini onjengu laba futhi abanye abangena abanye sebasishiya. So thank you guys to share my story with you, and lincedise kakhulu ukubona iZimbabwe CIVIC Liberties and Drug Network. Ngiyabonga.
Wakana njani to a point yokuthi size sifike lapha esikhona namhlanje. When I was raised in a God-fearing family, ngakhulela a family neyithanda ichurch kakhulu, so put God first. Sakhula sisiya church, ayingalove church, it was a legal rule of a church in Kai. Kai church it would come first. So ngamfaka ifaith yami yonke uNkulunkulu church. But then was okwenzakala was of a point in time whereby uba ama-relationships esiba nawo as people sisonke ngathandana nomunye usisi ngase ngikhulakhulile. I was in my mid-20s. Then it so happened ukuthi usisilwana wasezithwala. So uthe pregnant usisilwana ngaba le fear yokuthi ngiya-approacha njani ifamily yami because ngangibayesaba. But then I thought to myself ukuthi no, but mina ngile support system ye-church, why not go and try ukukhuluma nabantu be-church so that I can get help e-church. To be honest, bakithi mina owenza ngaqalisa ukunatha utshwala e-church. I went to a church and talked to one of ama-leaders yethu and they blamed me. But when I ndiyakwazi thina sivumile lokho e-church, hey vele wena embarrassment to our society, ulilema, they call me all sorts of names. And then into eyenza kwaba a bit easier ukuthi kibo unkazana bangi-accepta nginjalo, kodwa understand uyatholakala vele kukhulwa njalo. So then, but because of my insults engawatholaya from a church, I then thought to myself, why not just try ibhawa sibone? Ngabe ngisuka ngako madamara. I met a few guys khona ngale. Kodwa angifundisi akuzwe phela lapho uthi kunjani, aqala ngani ngiyayesaba. Ayide sipho pharmacy first. Angeze ngani kuyambabeli ngani kunjani njani. Nathisa le beer futhi ngizwa ubaba kakhulu lokho ngababalekela. I went back again futhi the following day. Ayide sipho beer ngizwa sezikhipha kodwa kathesi. Ngani siba mnandi. Aqala ukuhlangana nabanye nansi imbanje marijuana. Aqala ingane iyangarasa, ingane iyangikhathaza. Okukade ngayiphinda after West 2 ngezwa ziyakhipha. Ngayiphinda West 3 ngezwa ziyabuya. Until I got to a point yokuthi ngangasakwanisi ukumanage ukwenza anything without taking a pull of marijuana. Yes, uNkulunkulu because marijuana yamphuma masinyane. Ahle ngathi I'm doing away with it masinyane ngingedwa nje kuphela. Kodwa when it comes to utshwala i-casting ngendlela emnandi ngayo kakhulu unqela ngalichisa so yeah, you know, I was struggling ukuthi ngithi I have been struggling, and I also noticed ukuthi ekurecovery kwami enye into kade senza ukuthi ngibe lokho nginatha kakhulu. It was a case of ukuthi ngihlala ngi-free, and you know ukuthi an idle mind is the devil's workshop nje uyakwazi. So kokuyani ukuthi ngi-free kakhulu, I have nothing to do, ngicela sengisiba nama-cravings amaningi for taking even a lot more. So ngiyabonga kakhulu iZimbabwe Civil Liberties and Drug Network bangikumsebenzi lapho sengikwanisa ukuthi khathesi ngibe ngi-occupied. For as long as ngi-occupied angibe le craving, just like today ngiyabona ukuthi vele angihaweli lutho. Angokhiya amanzi amnandi, lamajuice amnandi, le tiye ibimnandi. So for as long as ngikwazi ukuthi I'm busy ngiba occupied, ayifuni anything to do with other drugs. So I'm very grateful to Zimbabwe Civil Liberties and Drug Network for assisting me ngomsebenzi, and njengoba bekulama-promises ukuthi befuna senza amanye ama-workshops in the near future, I'm hoping ukuthi ama-workshop lana azangenza ngibe busy kakhulu so that I do not even think of doing into zama-drugs.
My name is Knowledge Mupembe. I'm the Programs Officer with Zimbabwe Civil Liberties and Drug Network, an organization that advocates for drug policy reform, harm reduction, and the prevention of HIV amongst people who use and inject drugs. So we've been in Bulawayo with journalists and media practitioners in trying to sensitize them on the matter of language use whenever they are reporting issues of drug use and drug addiction, as well as harm reduction. So this has been done also in Harare and other provinces where we're like having a national retreat with journalists and trying to say what sort of languages and terms they should use in trying to, or whenever they are reporting issues of drug use, so that we will help our communities who are struggling with the drug use. So the media plays a critical role in shaping what the society knows, and also in helping those in need. So as you can see, people who use drugs are struggling with addiction and drug use disorders. They need our support and they need our help. So if we use stigmatizing language or language that dehumanize them and language that stigmatize them, then we are not like supporting them or even giving them empathy to access services. So when someone is in the process of recovery or in the journey of recovery, that person needs support and doesn't need stigma and marginalization. So we have identified media practitioners and journalists who shapes what the society needs in trying to say whenever they are reporting their stories about drug use and drug addiction, they won't use stigmatizing languages like drug abuse or habits or junkies or chidakwa, but they will use a person first language, which you say this one is a person. It's not a problem, but he or she is a person with a drug use disorder, which is a problem, not himself is a problem. So we are happy that journalists have shown a commitment in trying to change their behavior, and also they are reporting on this issue of drug and substance use and not using this stigmatizing and dehumanizing language. And it's not only in Bulawayo, but as I indicated, that this engagement is a national retreat whereby we are trying to hit all the four corners of the country in trying to destigmatize drug use and encourage people, our families, our society, to have support of those people who are in need of rehabilitation, in need of harm reduction, and in need of treatment services whenever they are in the journey and a process of drug recovery.
Well, we've come to the end of the show for this Monday morning. I've been talking to Zimbabwe Liberties Civic Network focusing on drugs and substance abuse. They're teaching many people about which language should be used, how do we address people that are using drugs and alcohol. Hope you guys enjoy the show, and please do follow us on all platforms. We are there on TikTok, Instagram, Facebook, YouTube. Please do go there and support our programs and like our shows there on site's Facebook page. Anyway, for myself, Brighton Ncube, is bye for now.